It is the 20th of June 2021, halfway through the year 2021. A very good afternoon. Thank you so much for tuning in to watch UBC News Roundup today on Sunday. Now in our top stories of the day, President Yoweri Museveni and that of DRC Felix Tshisekedi this week launched construction works of roads inside the DRC to be constructed by the joint partnership between the two governments. UBC TV spoke to the engineer-in-chief, Wilson Bagonza, on how the two governments will co-share the project cost and the benefits.
The launch was held at Impondwe Bridge, Uganda's Kasese district, and Kasindi in the DRC's North Kivu province. Uganda's President Yoweri Museveni and counterpart from DRC Felix Tshisekedi launched the construction of key roads to improve trade between the two countries.
Monsieur le Président, sous les acclamations de l'assistance.
The roads include 80-kilometer Kasindi-Beni and Beni-Butembo, 54 kilometers inside the Democratic Republic of Congo, and 89-kilometer road from Bunagana in Kisoro district to Ruthuru-Goma in DRC. The government of Uganda, through the Minister of Works and Transport, and DR Congo will each contribute $66 million, about 223 billion Uganda shillings, which is about 40% of the total cost into the construction of the roads, measuring 223 kilometers. The total project cost is estimated at $330 million.
60% of that money from development partners, private sector financing, and bring it into the project. Now, the idea is that money from the contractor will be injected into the project, used to construct the roads up to tarmac level. Then the contractor will charge tolls for the road users.
The project will mostly benefit business fraternity transacting between Uganda and DR Congo.
Naye engudo zibadde mbi nnyo emmotoka tezisobola kuyitamu. Naye twebaza owekitiibwa Pulezidenti Yoweri Kaguta Museveni omukago gwaguddewo ne ggwanga lya Congo nti kigenda tuyamba nnyo.
Project eno egenda tuyambako ffe ng'abayuuthi tujja kuba nga tukola businesses bulungi. Secondly egenda kuizeninga transport.
Kubanga kujja kubaawo speed delivery of services and items.
According to Uganda Revenue Authority, Uganda exports goods worth over 1 trillion shillings to the DRC, and improved infrastructure will ease access of products to the market in both countries.
Uganda exports goods worth about $500 billion for the last financial year, 2020, to DRC. That can easily quadruple or even times 4, 5, or 10 once the road is good.
While in Congo, President Museveni told the Congolese that after DRC joining the East African community, he will support all developments to benefit the two countries.
So I want to thank His Excellency Tshisekedi. Je voudrais remercier son Excellence Monsieur Tshisekedi for bringing Congo into the East African community. Et de nous avoir conduit dans cette union africaine. Because Congo outside the East African community was artificial. Parce que le Congo en dehors de la communauté est-africaine était artificiel. You cannot talk of East African community without Congo. Nous ne pouvons pas parler de la communauté d'Afrique, des États de l'Afrique de l'Est sans parler du Congo. And we are ready for more projects. Et nous y sommes encore pour beaucoup plus d'autres projets.
Au lieu de construire des murs entre nous, il vaut mieux construire des ponts.
It is better to build bridges.
Construction of the Impondwe-Kasindi one-stop border post and the Impondwe border export zone is also underway to facilitate trade, movement of people, goods and services between the two countries. Bernard Higa, UBC News, Kasese.
President Yoweri Museveni has slapped a 42-day ban on public transport and rationalized curfew hours for pedestrians and border riders. This was contained in his televised address to the nation on COVID-19 pandemic update early this weekend. Now, the president said many people were flouting the inter-district travel ban, while Chikobo traders were deliberately overcrowding, a situation that has been fueling the COVID-19 threat.
Government will aim at reducing the speed and the intensity of transmission within the next 42 days, so that the number of new cases is less than the available bed and oxygen capacity in the country. I have also observed marked reduction in congestion around Kampala and more use of masks, meaning people are increasingly adhering to the SOPs. I thank you and commend you more for this patriotism. To achieve the above two strategic objectives and augmenting my observations above, starting 2200 hours today, 2200 hours is 10 o'clock, 18th of June 2021, I'm revising and updating all the directives I issued on the 6th of June 2021. All cross-boundary district and intra-district movement of public transport and by private vehicles or borders is hereby suspended for 42 days starting today. Further, the Minister of Health and Kampala City Council Authority are hereby directed to make all the necessary arrangements to ensure all individuals that require medical care and medical evacuation in Kampala Wakiso are taken care of. Across the country, the resident district commissioners working with the chief administrative officers and their district health officers are directed to make all the necessary arrangements to ensure all individuals that require medical care and medical evacuation in their respective districts, COVID-19 or otherwise, are taken care of. All schools and institutions of learning remain closed for 42 days. The Minister of Local Government is hereby directed to support the regional task forces and the district task forces to be reactivated and supported to reinforce the compliance of all SOPs. The Minister of Finance and Economic Planning is directed to support the regional task forces and the district task forces should be reactivated and supported to enforce compliance of the existing SOPs. Uganda is a landlocked country. All movements or cargo movements to and out of Uganda will be allowed without any disruption. Cargo truck drivers at land border crossings will be tested, allowed to move, and be followed up at the designated seclusion areas and holding places for cargo trucks. Cargo trucks should no longer park in the trading centers. We should go back to our plan of designated seclusion areas. That's where they should park. Not parking everywhere. That's what we had done the other time. I don't know why people abandoned it.
In the course of the week, members of parliament said inadequate oxygen in hospitals for COVID-19 patients, high cost of treatment and high cost of testing the disease may escalate the COVID-19 crisis. Now, the members of parliament now urge government to intervene and regulate the COVID-19 treatment charges across all hospitals. According to legislators, this can be done by government offering incentives or tax waivers to the private hospitals. Details follow.
The increasing costs of COVID-19 treatment by hospitals across the country is worrying the MPs, saying the poor may be at disadvantage since they cannot afford such costs. According to media reports, treatment of COVID-19 in private hospitals costs between 3 to 5 million shillings a day, costs an ordinary Ugandan cannot afford. This is the reason why the MPs want government to intervene and regulate the costs.
Without any policy, it is the role of government to protect people and property. And therefore, hospitals cannot continue exploiting Ugandans who are sick, and then we keep quiet as government. Just the other day, we saw Nakarema swing into action, move around parks, arresting bus owners and attendants. Why can't we see somebody moving to hospitals and ask why there is an increase of prices unnecessarily?
Someone is taking his own measures, the way we can milk from Ugandans. Every hospital is setting its own standard, but it's private. In Uganda, we had something called Kasawo and Ingalonkaru. When you visit a medical facility, you have something, you'll be catered more. If you have no money, no one will care.
Some of the legislators have also expressed concerns over the high costs of testing for COVID-19.
Currently, we are spending 100,000. That is the cheapest fee one offers for testing COVID. That is still too high. It should come down to at least 30,000 because we are telling our populations to vaccinate after testing. But if the testing is expensive to that level and then the vaccination is for free, then it's as if you are refusing people to vaccinate. So it is better we make the testing cheap.
I'm also calling upon the owners of these private facilities to have the heart of this country. We should not use this opportunity to cheat our fellow Ugandans. We should not use this opportunity to actually, trouble our own people. The poor are now the most disadvantaged. We should take into consideration the lives of the vulnerable.
According to the MPs, inadequate oxygen in hospitals, high costs of treating COVID-19 and the high costs of testing the disease may escalate the crisis if something is not done by government.
I want to ask the Speaker at some stage that we need to come back as Parliament, see this as an emergency, and look for money to help Ugandans. Ugandans cannot die one after the other, and we are Parliament, and we are leaders, and we're just quiet about it. I think we need to come as Parliament, have a sitting specifically to discuss COVID, to discuss interventions by government, because Ugandans are dying.
We need an urgency meeting to talk about people being charged a lot of money.
Uganda has so far registered 68,779 COVID-19 cases, 584 deaths, with most of the cases registered in the second wave. Philip Aguta, UBC News at Parliament.
The Ministry of Health this week received oxygen concentrators to support Uganda's health system attend to the increasing COVID-19 patients in need of oxygen. An oxygen concentrator is a device that concentrates from a gas supply by selectively removing nitrogen to supply an oxygen-enriched product gas stream. Two methods in common use are, and details follow.
The Director Clinical Services at the Ministry of Health, Dr. Charles Olaro, has received 25 oxygen concentrators from Bismart Technologies Limited at the Ministry of Health Headquarters, Kampala.
This is part of 65 oxygen concentrators which have been donated to the Ministry of Health.
The German-made 5-liter oxygen concentrator is designed to accommodate a single patient at a time and can generate oxygen consistently.
Non-stop 24-hour. Okay, so you just need to add the water and power up, and he will continue to generate the oxygen. Okay, so you don't have to replace or refill. It will continue working.
These are meant for patients who need less than 5 liters of oxygen per minute.
Not only for COVID cases, but also for other cases for continuity of essential services. For children who are just born with birth asphyxia who need oxygen, this also can be able to do. For people with the cardiac failure and pneumonia, they can also be able to do it. So we'll be able to use it even after COVID, they can be able to use. So we want
Bismart Technologies Limited intends to support the ministry with other 10-litre oxygen concentrator consignments. Ivan Kahwa, UBC News.
The director of Uganda National Expanded Program on Immunization, Dr. Alfred, says AstraZeneca vaccine is effective against the new COVID-19 variants. He, however, says that it is not 100% due to the fact that it has been found to be resistant to the immune system of some people. We have details on this story.
There are a lot of misconceptions and myths, especially on social media platforms, about the efficacy of AstraZeneca vaccine against the new COVID-19 variants. A study conducted by Visa about the efficacy of AstraZeneca allays fears about the vaccine. According to the study, AstraZeneca is 60% effective against the Indian variant and 66% effective against the English variant. Both the two variants are among the many variants in Uganda.
And this kind of unresearched information which is being spewed to the community only helps to achieve confusion, and it only helps to accelerate spread of the disease because people become undecided.
In both cases, the effectiveness of AstraZeneca was measured 2 weeks after the second shot and against symptomatic disease. The dominant English-Kent variant and the feared Indian strain, both in Uganda, have been outpaced with the completion of the 2 doses of AstraZeneca immunization test. Against this globally proven test of the vaccine, Dr. Driwale says AstraZeneca is effective against the COVID-19 variants.
Then it is going to train itself and practice fighting COVID on a vaccine, so that the chemicals will be produced, the cells which eat the virus will be produced, and cells which will remember that I was once attacked will be produced. And after that, the body is ready. Should the COVID-19 virus enter your body, it will find the soldiers are ready, and it will fight the disease without giving it chance to multiply.
Despite of its efficacy against the new COVID-19 variants, the Oxford AstraZeneca vaccine is based on the virus's genetic instructions for building the spike protection. According to Dr. Driwale, the vaccine prevents development of severe disease through controlling the virus from multiplying in the body.
So it prevents severe forms of disease which will require hospitalization, which will require intubation, and which will eventually progress maybe to death. There are people who still, in spite of their vaccination status, have been found positive. There are those who have developed severe forms of disease, and indeed there are those who have died.
In the past, fears had built up in a number of countries over the safety of AstraZeneca vaccine after several cases of blood clot or brain hemorrhages in people after receiving the vaccine, with a small number of deaths reported. Dr. Driwale treated these observations about the vaccine as isolated cases, but revealed that glitches were caused by the failure of the body to make good use of the vaccine.
You see, vaccination is the act of giving the vaccine. Getting immunized is your body reacting and building antibodies ready to defend. There are people, when they're vaccinated, their bodies will not make use of the vaccine. And when we say the efficacy is not 100%, it means when you vaccinate 100 people, out of the 100, you may get 10 people who will not make use of the vaccine.
However, Dr. Driwale says the vaccine becomes effective in one's body after 14 days of receiving the injection. So it cannot protect anyone who contacts COVID-19 before 2 weeks.
You get the vaccine today, the body will take 2 weeks to mobilize the immune system, the soldiers that fight disease in the body. It will take about 2 weeks to mobilize. Within that period, although you are vaccinated, you are unprotected. So, if you are infected within that period, the disease will move, and it is your natural body which will be fighting.
At the moment, the first dose only gives 60% protection from the disease, and one requires to get 2 doses to be fully protected. He says it is not a precondition to test before vaccination because it does not make public health sense.
What we know is 1 dose will give you immune response between 50 and 60, 1 dose. So if the level of protection is 60, then you are the 40% you are vulnerable. So 1 dose is protection. You are better than someone who is not being vaccinated at all. Yes, but you are not fully protected.
According to him, many people who have been vaccinated and contracted COVID-19 got mild symptoms, and some who were fully vaccinated succumbed. He explains that AstraZeneca is a non-replicant vaccine that does not cause infection.
Many of the people who have been vaccinated, they are found positive with the COVID, and they have no symptoms, or they have mild symptoms, and they are resting at home, and they are doing well.
Uganda has vaccinated close to 1 million people, with only 60,000 receiving 2 doses. However, these numbers are very small compared to global statistics. I'm Nafka Farida in Kampala.
Police on Saturday evicted city dwellers who had flocked the city centre to carry out business as usual. Police had to apply force and chase away the non-compliant persons. Now, police promises not to relent until all Ugandans abide by the presidential directives against COVID-19.
It has been a hide and seek in Kampala as police enforced the presidential directive aimed at preventing COVID-19 spike. The 42-day ban imposed on a section of businesses kicked off as soon as President Museveni ended his televised address.
The first days have not ended, but again he has added again to 42 in the way that it really affected us as traders, in the way that we are still disorganized.
What I work is what I earn. But also we need life. We need life among, because if these numbers can exceed, it would be very unfortunate.
Business arcades, malls and other business centers in Kampala city were among those affected by the new COVID-19 directives.
Ekikubo kiri saidizeri ate ekigaza energy center eri saidizeri kiba ki?
Because we didn't know that arcades were closed, only that we heard that you said that business center are closed, but we didn't know that whether you mean arcades are closed or Chikubo only.
In his recent last address to the nation, His Excellency Yoweri Kaguta Museveni issued stringent measures in terms of containing the spread of the deadly COVID-19 pandemic. Amongst them was the halt to the public means of transport. This was anticipated that it will limit on the movement of people from one place to another. But as you can witness, downtown Kampala, it's a different scenario as people continue flocking into the city center. Though malls and arcades are under key unlock, this leaves a lot of questions as to whether the stringent measures issued by the president can at least drive us to another level.
With others justifying their presence in town, police was resolute in enforcing the presidential directive.
The motive was to make sure that people are not in Kampala, and especially the CBD, where a lot of traders are taking advantage, camping at their shops, and after a short period of time, when they get customers, they enter those shops to get merchandise to sell. So our aim is to make sure that all those people are away, vendors are away, those that are selling items along the roadside are away. That is our motive today.
After hours of hide and seek between security and members of the public, some arrests were effected, but the situation remains tense.
Today is the day to just warn people. But starting from tomorrow, we shall put up our checkpoints on all roads that are coming into town. No one will be allowed, and those that will be found using force to enter the city will be arrested and arraigned in courts of law for fines.
Police say it is determined to enforce the directives aimed at ensuring COVID-19 is slowed down and eventually eradicated. Robert Onyango, UBC News, Kampala.
Well, guess what? It's just the second day of the total lockdown, so we still have 40 more days to go. Now, Ugandans have been called upon to embrace standard operating procedures against the COVID-19 pandemic to avoid more casualties resulting from the same. This appeal follows recent surge in the cases of the virus that have been since prompted the head of state to actualize another lockdown as announced on Friday evening. Uganda People's Congress Party President Jimmy Akena supports government position on this, calling on the public to embrace safety.
It was concern after complaint, lamentation after outcry, and appeal after request. As a loud silence filled the emptiness of Nigeria Road in Kiwatule. This is as a result of a second country-wide lockdown brought about by the coronavirus pandemic, whose effects have been felt worldwide. From small numbers, people walking increased as some rode bicycles to various destinations. But behind this walking is an inconvenience some claim is annoying.
Kubanga amalwaliro gamu tegawa mmere kati oba olina kulabirira omulwadde olina kuloonya breakfast y'omulwadde, lunch y'omulwadde, sapa y'omulwadde, oba olina kutambula genda n'obinoonya. Ate bw'oba tolina entambula kikosa obudde bw'omulwadde kubanga jjukira omulwadde alina kumira eddagala mu budde.
Motorcycle riders, also known as border boarders, whose operations were halted except for carrying merchandise, patients and special cases, are not happy.
Kati nganze nzali bwe Rukunji okiraba naye kati saawa zino sisobola gende ewaffe Rukunji ate na wano wendi sina kyenkolawo ate mu nsawo sibaddemu na kasente olaba lockdown yatandika dda.
Some are worried of their failure to service their loans, besides inability to make a livelihood out of their routine.
Ngene mbere ejo batuyamba baliyo bagarukamu baterezemu bamemba ba parliament mwena mwirukanga speed ekiteso mu kitwale mu parliament.
Tetulina kyakulya tetulina kyakukola kiyasazeho olumu ffe tulina gye tubeera fa tutatugende ewaffe mu byalo tujja kufuna kye tulya.
However, Nsaimana Innocent, a security guard hailing from the Western District of Kisoro, has a contrary view.
No gamba nti bagende mu byalo. Zisobola genda mu kyalo kubanga waffe Kisoro. Tisobola genda kutomo kadde na binerekayo. Wakiri tubeera abantu watono nenga twewonye ekirwadde.
To support his argument is UPC party president James Akena.
it is not a Uganda problem, it's a global problem. And it is something which we must approach and do everything we can within our own power to ensure that we don't be part of those spreading it.
Akena agrees with government measures in finding a lasting remedy to COVID-19.
So following the SOPs, washing hands, safe distances, wearing masks, not moving unless it is extremely necessary, it is critical for the general well-being of the citizens of Uganda.
On Friday evening, President Yoweri Museveni announced a 42-day suspension of most activities in the country, meant to prevent the spread of coronavirus that has left many dead. Henry Okrut, UBC.
The Amuru District Resident Commissioner Osborn Ocheng expects the 42-day lockdown to hit the district hard. Being a border district, the RDC Osborn Ocheng says although they have reactivated the village health teams, the backbone of the district is its border businesses, especially around Elegu town, which they expect comes to a standstill. Gulu District LC5 Chairperson Christopher Teka Opio says that the lockdown is timely given the overwhelming cases of COVID-19 deaths.
Amuru District has reactivated village health teams with cross-border meetings expected with their South Sudan counterparts to ensure that standard operating procedures are followed to the dot. In Gulu City, a few ambulances can be seen crisscrossing the city, either picking or dropping patients. Gulu District LC5 Chairperson Christopher Atiker Opio says the lockdown is timely because COVID-19 has had a big impact in the area.
The border, the lockdown is bringing serious pain on the business community because most of their client comes from South Sudan in Nimule, and they look at themselves as one border community. But now COVID has made it hard. So we'll advise them and talk to them, and also have a cross-border meeting to do surveillance, and also ensuring that we control the border fully. There are those who are using porous borders. These are things that we are going to control.
Opio wants Gulu residents to adhere to presidential directives in order to curb the spread of the virus. A number of residents, however, have started feeling the pinch, as Akidi Winfred Ochaya, a resident of the city, narrates.
And as Gulu District Local Government, we want to appeal to our community to heed to the advice of the President. Because now, looking at our hospitals, the oxygen, they are very few. Like you, as I talk now, they are overwhelmed. So I want to appeal to our people, especially the border and the businessmen, to see that they follow the SOPs. Otherwise, we are going to have very serious problems.
Akidi wants local leaders to step up and be available for the underprivileged residents. While Pastor Nelson Obo expects crime rates to go up due to the high level of poverty.
It is very, very hard because I'm somebody who is not used to walking. But today I've walked, I think now I've walked roughly around like 7 miles from morning to now. Get to know that, like the public, because our offices are very far from town, seriously. You want to get to any official, you need to make a phone call. Sometimes you call, they don't pick, sometimes they pick until like, I'm not there. But this person is seriously sick down here and in the process of dying.
And it's hard for them to operate and do business as usual. So to me, it's another hard time that the country is going to face, and we should brace ourselves for this.
Owor Arthur, a researcher with the Center for African Research, warns that illicit trade in charcoal, timber and land will most likely increase during the lockdown.
We notice that people do exploit the vulnerabilities of the people. Land deals actually go on, unregulated, uncontrolled. People lose lots of acres of land in such deals, between buyers and sellers who are very unscrupulous. Number two, we also notice from a perspective, since there are light trucks actually moving, there are people who are dealing in charcoal, So because light trucks have actually been allowed to cross from one area to the other, such actually do happen, and a lot of
Moving on, still in the course of the week, vetting of recently appointed ministers has successfully moved on and has been concluded, with more of them promising exemplary leadership. State Minister for Housing Persis Namganza expresses readiness to address the housing both in rural and urban areas.
I wouldn't want to start from a point of pessimism. Lots of things have been done, but we can do better, especially in areas of effective policing. I think we are still below the ratios, universal ratios of policing. Issues of image, yes, image. Issues of motivation.
Of course, this is a sector which has been given very minimum attention by the government. Right now we have the deficit of 2.1 million houses. That's a very huge gap which we need to cover up. Talk about the lack of institutional houses, like for teachers, health workers. Like in this particular period of COVID, we would have had our health workers quarantined where these medical facilities are, if they were those health workers' houses.
It's not that you dream a district should be and it becomes. Baseline studies are made, the committees go and visit and establish. By the time Parliament rules and decides there should be a district, it means there is a need. And it is the mandate of government to take services nearer to the people. So it's not a hazard that districts simply come up.
This is an assignment. The other one was more of humanitarian work. I have now been deployed to handle development proper. So I'm happy to move on. I'm very happy to move on.
Nenda kukolera abantu ba Uganda bonna nga sisosola. Nkugambye ne bali bangambye sisosola. Saagala kusosola. Bonna abantu ba Uganda bonna mbaagala, bonna balungi, bonna baagala emirembe, bonna baagala okukulaakulana. N'olwekyo nze kuweereza njakuleete ekyokulabirako ekitabaddeewo eri bannayuganda bonna.
I am indeed challenged, but I know the God who appointed me is the one going to lead me through. And I know the God who I serve is always a just one and is a parent. So He will lead me through it, and we shall excel, I tell you.
Buhendera County, Bundibujo District newly elected members of Parliament government's intervention to address the influx of refugees from DR Congo for safety. An estimated 1,000 Congolese refugees are in Bukukwanga, a camp after fleeing the ADF operations in DR Congo. Local leaders have isolated them to prevent the spread of diseases to host communities. Kawa reports.
The number of refugees seeking asylum in Uganda due to the Allied Democratic Forces insurgents in the neighboring Democratic Republic of Congo is worrying Bundibujo leaders.
For fear of what is happening in their country,
refugees are accessing Uganda soils through porous borders, mixing with people in Uganda amidst the COVID-19 pandemic.
These are people who are just entering the country without being tested.
As a district, we saw it that we cannot just keep seated, and we had to evacuate them from those sub-counties of Rondo, Ngamba, Totoro, Tandi, and Bukwanga.
The number has reportedly increased to over 1,000 refugees in an IDP camp, Bubukwanga, Bugendera County.
Then after realizing that we are very many, I communicated to my fellow leaders on the district and MPs and RDC. These people, they are almost 900.
There are so many people who are still in the community and they are fearing to actually come to the transit because there is no support, and most of them keep coming and going away to look for survival outside. As a district, we are trying to make sure we give in what we can, because as of now, the total number of refugees have gone over to 1,000 plus, with over 179 households. Majority of these people are children, and most of them are anemic. We cannot handle this when we are not together as a country.
From wherever they were, it was me, the legislator, who provided means of transport to the IDP camp. Regarding food, the local district administration and myself, we contributed food to ensure that these people survive.
Bugendera County Member of Parliament and Bundibujo local leadership have isolated the refugees from the population.
We have removed them from the people. We have put them together at an IDP camp, ready to be transited.
Kiza Moses wants government to come to the district leadership rescue that is overwhelmed by the influx of refugees. He has so far written to the Prime Minister and the Ministry of Disaster Preparedness and Refugees over the matter.
If not, then the problem will escalate, because you know that there's nobody who can survive without eating.
Uganda People's Defense Forces are in Democratic Republic of Congo to neutralize the Allied Democratic Forces. Ivan Kahwa, UBC News.
A UPDF soldier who was captured by the Rwandan army on Saturday evening was early this week repatriated to Uganda. Private Bakuru Muhuhu was received at Chanika border at 8 p.m. by a security team led by Kisoro RDC Captain Kyomugisha. Details follow.
In a statement issued by Rwanda's Defense Ministry on Sunday, the Rwanda Defense Force Patrol intercepted Private Bakuru on Rwandan soil in the northern province of Berea District, Chanika Sector, Kamanyana Cell, Majembere Village. Bakuru was dressed in UPDF camouflage uniform, armed with a medium machine gun with 100 rounds, one binocular, one cell phone, and his military identification documents. The Kisoro Resident District Commissioner, Captain Kyomugisha, said that it was unfortunate that the soldier was captured due to failure to identify the boundary mark.
Next time, be a soldier, you should not make another mistake.
Yes,
sir. Eh?
Yes, sir.
Maybe sometimes you move once you are moving, you move with the GPS, so that you know where you are.
Chanika Town Council residents say that the two governments should agree, make clear boundary to avoid similar incidents in future.
Otherwise, you can't know. There is nothing that can show you have crossed to Rwanda, neither anything that can show you have crossed to Uganda. So it wasn't intended, but he found himself on the soils of Rwanda, and themselves also have been coming, and we have been telling them we are now in the wrong whatever. So it is upon the cooperation and whatever, otherwise.
They say Rwandan soldiers always cross from to Ugandan territory while chasing their citizens who use illegal entries, but none has ever been arrested.
Let's take a short commercial break and we'll be back with more that transpired during the week.
Therefore, understanding this model. Hey, excuse me, lady. Who do you think you are? A queen?
Hey, haven't you heard? Get Airtel Chillax bundles and browse like a queen.
Get Airtel Chillax bundles that do not expire and browse like a queen or king. Dial *175# or use My Airtel app. Airtel, the smartphone network.
In chess,
the small one can become the big one. It's the same here. And here too. Watch every move. Record every number so you can plan better. No matter the size of your dream, tomorrow's success belongs to those who keep today's records clean. File your returns today.
Uganda Revenue Authority, developing Uganda together.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from a SEN project.
What does it mean to be closer together? It's taking the last bus home for a surprise visit. Closer together is strangers finding a connection. It's bringing home something much more than a box. It's the warmth of home, or the beginning of something new. There's magic in sharing the things that we love, because it's those things that bring us close together.
Welcome back from that short commercial break. In our business stories, 4 men were early this week killed in a stone quarry in Muyenga, Sechindi zone after a rock collapsed and buried them instantly. Leaders remain puzzled on why the quarry still operated, yet it was closed in 2004 by then Kampala City Mayor Sebana Kizito II.
Residents of Sechindi zone in Muyenga parish this afternoon were saddened by the untimely death of 4 quarry workers working at Muyenga Stone Quarry as a huge log collapsed and covered them. By press time, we found police had removed the bodies and were being put onto police patrol cabin, ready to be taken to Mulago City mortuary for postmortem. Eyewitnesses and fellow workers of the dead narrated the trial moment that happened in the afternoon.
Still operating. Recently, I wrote, it was even in the New Vision, it is here. Then after that, I met the minister, Madame Anyua, Mama Mavira. We discussed. She agreed that this quarry must stop. You cannot have a quarry in the middle of a capital city. Even a kid of 7 years old can reason that. You don't.
It is alleged that the quarry belongs to
Now in our sport stories, one member of Uganda's Olympic team has tested positive to COVID-19 on arrival in Japan ahead of the postponed Olympic Games that started on the 23rd of July. Uganda's first batch of athletes and officials to the Olympics arrived at Tokyo's Narita Airport on Saturday and immediately took the mandatory COVID-19 test. Prior to departure, the team had undergone the mandatory 2 COVID-19 tests. Now, unfortunately, an unnamed member tested positive and has been maintained in quarantine, while the others headed to Izmisano, where a pre-games camp awaits. Uganda's team was led by government official David Semakula Katende and included weightlifting coach Hakim Semperez and 2 boxing coaches Patrick Lihande and Mulandi Musa. The athletes were swimmers at Haire Ambala, weightlifter Julia Sechtoliko and boxers Catherine Nanzidi, Shadir Musa Woji and David Kavmas Semuju. Uganda Olympics Committee President Donald Rukari has confirmed the positive test but maintains intent on safety and health of the team remains of their paramount priority. Well, thank you so much for watching the UBC News Roundup today on Sunday, the 20th of June, 2021. My name is Sharon. Kyomugisha, have a good afternoon and stay tuned for more programming coming your way.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the low